one of my favorite stories of when I started Lyft was the biggest market for non-emergency medical transportation is Medicaid. So Medicaid has offered transportation benefits since the program's inception in the mid-60s. And therefore, every state, you've seen one Medicaid program, you've seen exactly one Medicaid program. Every state had different, rules and regulations around the vehicles and the drivers and very specific things. And I remember going in to talk to a Medicaid director early on to talk about what we were doing and why basically they should have Lyft or a rideshare company as an enrolled provider, essentially. And I remember him saying to me, well, right now, drivers, non-Lyft drivers obviously, write down the odometer reading when they pick up the patient, and they write down the odometer reading when they leave. How are we going to get that from you? And it was just kind of one of these wow moments, an aha moment in terms of, what people were used to, not used to, very tech forward, company coming in to modernize what I think is overall, not a great experience for patients. So those pieces were interesting because it was how could we take the best of this B2C company and really leverage it within this B2B vertical, right? So there's a lot of benefit, right? Amazing technology. Lyft does a fantastic job with marketing. They had a stellar policy team because they had to go around state by state and just get the rideshare, just the normal rideshare portion, right? Policymakers to adopt that in each state. So it was unusual for me because having come from a career in healthcare, everybody knows your jargon, everybody knows the market. I really had to take a step back when I came to Lyft because you spend a lot of time, educating on just fundamental market dynamics, how the dollar flows, different incentive structures, right, that a payer would have that's different than what a health system would have, and then making cases on why healthcare, why should you invest here instead of bikes or scooters or autonomous vehicles or anything else. And there's a fair amount of making some noise and banging my fist on the table so they pay attention.